Hi, I'm Dr. Swarup Pal. I'm the Chief CVTS Consultant and Transplant Surgeon at Dr. L.H. Hiranandani Hospital. On World Heart Day today, I will be talking about the different surgeries that we do on the heart, most importantly CABG or bypass surgeries, and then move on to transplants. So, bypass surgeries, usually when does that happen? Well, that happens when we have a lot of blockages in the blood vessels supplying the heart. So what are they? So as you can see here, the heart is usually supplied by three main blood vessels, one on the right and there are two blood vessels on the left side. If any of them get critically blocked, a heart attack results. Once a patient comes with a heart attack, he usually has to undergo stabilization, then an angiogram is done which confirms these blockages. Well, how do these blockages look? So this is how the blockages look. As you can see, this is a normal blood vessel. This is a blood vessel which has a blockage which is about 50-60% compromising the lumen of the vessel. Now this guy here has almost a 90 to 95% block. This is a guy who is very critical and will need some intervention. Now coming down to intervention, what do we do? Only medicines, will this suffice? Well, no. So along with medicines, we will also have to undergo either an angioplasty or a heart bypass surgery. So the other question that patients ask me is, how do we decide, doctor? Well, let's look at this figure. Here you can see there are blockages in two blood vessels of the heart. Both these blockages are single short segment blockages. This is a good substrate. This patient is also not a diabetic. This can be easily angioplastied. So then when is a heart bypass done? Now let's go on to the next situation, which is more commonly seen. Now we come across patients with diabetes, bad blood vessels, multiple blockages, as you can see here. The red part that you see is calcium sitting on top of the blockages. These are the guys for whom bypass is a gold standard. In these guys, bypass is usually attempted and they do very well after surgery. Why do they do very well after surgery? Well, that's because we don't use any foreign materials inside them. We use their own arteries. These are the mammary arteries, and you can see we can harvest arteries either from the leg or from the hand. These are natural vessels which are present in their body. We use them for bypass, and therefore the bypass lasts for a long time. Now coming down to heart failure, well, even after bypasses, some patients can have problems with valves. They come with a very bad state after a long time. In this cases, the heart is barely functioning at 10 to 15%. How will we save these patients? Well, that is where the role of heart transplant and LVADs come in. So these patients are initially screened at a heart failure clinic. After getting screened, a cardiac MRI is usually done. After we have confirmed the diagnosis, we put them on the transplant pathway. What is done in transplant pathway is their own diseased heart, which is usually non-functional. And which are these hearts? These are these hearts who have ischemic cardiomyopathy or any form of cardiomyopathy. So these hearts are not going to make it otherwise. We put them on the list and then we get a new heart in their place. This is called heart transplant. Now obviously, transplant can take a little time. So when we are waiting and if the patient becomes critical, we will have to put them on a bridge to transplant. This is called as an LVAD or a ventricular assist device. So I hope in today's world, you have realized that we should not give up. We have more of new technical superiority, technical machines coming in, and they are really helping us to increase and improve the life of our patients. Recently, I operated on a patient who had a very bad coronary artery disease. He's a big guy, from a vice chancellor at an university in Nashik. He came down now because he was an outstation patient. The good thing about this hospital is we also have rooms which are next to your patient's room itself where the whole family can stay. So when he came, obviously a patient is very scared when he wants to undergo a major surgery as a bypass. He never felt scared in this case because he felt that he was staying at home, away from home. His relatives were there in the next room within the same complex. So that made him feel more comfortable. He went through surgery, he came out unscathingly, doing well. He was very happy. Even in the post-operative period, in fact, we were very happy to know that he and his wife celebrated their marriage anniversary on one day. He was in the hospital. Our hospital was always around him. We got a cake for him. They were very happy. And when he got discharged, there is one specific thing that he told me. He said, "Doc, I just want to tell you one thing. We've been to many hospitals, but we've never felt this connect. We stayed together, which in my opinion never happened in any other hospital. I've never seen the family members also be with the patient, and I think that helped me a lot. It gave me a lot of confidence, it boosted my morale, and we felt very happy." So when a cardiac patient undergoes a heart surgery, surgery obviously is the primary aspect. It has to be perfect. But apart from surgery, there are a number of people involved. The nursing care, the people sitting on the counter, the people around, the housekeeping. So all of these form a very important team. And for patient care, Taking all of these factors into consideration is also very important. They form a very important part in patient well-being, and that really helps and improves the results of surgery as well as any other medical ailment for which the patient is admitted. And as I said, we all take that extra care and that extra step to see that the patient feels at home and is taken care of at every step on this journey. Thank you.